From the outside, it can be hard for some to understand the severity of COVID-19.
They don't see what happens in the hospital, how people are sick, if they make it or not.
For Dr. Kishor Gangani, he's seen the virus do its worst.
I have more COVID patients than I see non-COVID patients.
Through Apogee Physicians at Texas Health Arlington Memorial Hospital, he takes care of patients from the time they enter the ER all the way to discharge or even death.
So it's very exhausting for me, with a small kid at home. It's just, it takes a lot.
For the past year, he's been at the hospital more than he's been at home.
I feel guilty and, I feel like I should be spending more time at home. And then instead, I'm here.
Here, saving as many lives as he can, but there is no magic treatment for COVID-19.
You do whatever you can, and still you feel like, you are helpless.
It's emotional for Dr. Gangani.
You see patient talking, next day you see them on ventilator. I have seen that.
It hurts every time he has to update a family that their loved one took a turn for the worst.
When you are breaking the news to the spouse that your husband is on ventilator or your husband did not make it, I cannot think anything more sad or emotional than that.
Old and young, he has seen it all.
Some of them didn't make it. It's just sad.
And it's frustrating for him. In the rare times he leaves the hospital, he sees people careless, disregarding COVID-19.
I would just still tell the people that, this is pretty serious disease and it does not have definitive cure. That's why we have to be even more careful.
And that's why he shares his perspective. In Arlington, I'm Tiffany Liu.